Welcome to the video. Today we will unpack why dental offices insist on identification, even during emergencies, and what actionable steps you can take if you do not have standard ID on hand. We will also cover how emergency insurance actually works, where to seek care when private clinics cannot proceed, and practical documentation alternatives. Let's begin by outlining our agendas. Then we will move into the facts, the options, and a clear action plan. Here is our roadmap. First, we will discuss the reality of identification checks and why they are enforced. Next, we will examine the legal, financial, and reputational reasons behind the policy. Then, we will present alternatives when standard ID is missing, followed by a comparison between private practices and federally qualified health centers. After that, we will clarify what emergency insurance typically covers. We will then walk through a practical action plan, test understanding with quick quizzes, and finish with key takeaways and a brief summary. Before we begin, please note this content is for informational purposes only. It is not legal advice, medical advice, or insurance advice. Policies differ by clinic, insurer, and jurisdiction. Always check directly with your provider, health center, or insurer for definitive guidance. With that clarified, let us proceed to the on-the-ground reality of identity verification. To begin, here is the practical reality. At check-in, dental offices have an obligation to confirm identity before proceeding. This is heightened during emergencies with severe infections or complex procedures because the liability and documentation stakes are high. Now that we have set the context, we will transition into the specific reasons why verification is non-negotiable. Let us detail the three pillars behind ID verification. First, liability and medical history. Without confirmed identity, a dentist cannot reliably access your medical records, allergies, or prior dental procedures. Missing or mismatched records create unsafe conditions and unacceptable liability. Second, insurance fraud prevention. Insurers require providers to verify that the person receiving care matches the policyholder or an authorized dependent. If a clinic bills without proper verification, claims can be rejected as fraudulent, and the provider may absorb the full cost. Third, reputational integrity. Clinics that circumvent verification rapidly gain a poor reputation and regulatory scrutiny. Consequently, reputable practices follow strict protocols. As we continue, we will discuss what options exist when you do not have standard identification. When standard ID is absent, consider alternatives. Some clinics may accept a current passport or recently expired passport, or a consular identification card, depending on policy. In certain jurisdictions, a non-driver state ID or a temporary ID receipt may help. Bring any medical linkages such as prescription bottles, prior clinic statements, or patient portal screens that show your name and date of birth. Ask whether two-document verification is acceptable, such as combining a utility bill with an insurance card. If the front desk cannot decide, politely request a supervisor or compliance review. Next, we will look at where care is most feasible if private practices cannot proceed immediately. Here is a comparison to guide expectations. Private practices typically enforce strict identification policies and insurance pre-verification. If you are fully verified, scheduling can be faster. However, if you lack ID, they may refer you elsewhere. In contrast, federally qualified health centers and public clinics are mandated to serve all residents, regardless of status. They often offer sliding scale fees and allow more flexible intake, specifically to stabilize urgent dental issues. This means that FQHCs can be a more viable option when documentation is incomplete. Now, let us zoom out and visualize your pathways using a mind map. This mind map organizes the main routes. Starting from a dental crisis node, one branch shows the straightforward path when documentation is available. That involves presenting state ID or passport, verifying insurance, receiving treatment, and billing. Another branch covers cases with no ID, where alternatives like a recently expired passport, a consular ID, or two-document verification may still open doors. If these are accepted, you may proceed at a private clinic or an FQHC. If not accepted, the route leads to FQHCs and public clinics that can intake, triage, and stabilize. A third branch addresses insurance reality, highlighting that emergency coverage usually pays for stabilization rather than restoration. A final branch lists payment options, including sliding scale fees, payment plans, and charity programs. Next, we will clarify what emergency coverage typically includes using a simple chart. Emergency medical coverage typically focuses on stabilization, such as managing infections or pain that pose systemic risks. Diagnostics like exams and X-rays are often part of this stabilization. However, comprehensive restorative work is usually not covered by emergency-only plans. In cases of severe infection, hospital-based care may be involved and billed under medical benefits. Be aware that medical and dental services are billed differently, which reinforces the need for proper documentation and identity verification. With that foundation, let us depict the practical intake journey to understand checkpoints and decision nodes. This sequence diagram shows the journey from arrival to stabilization. The reception requests ID and insurance. If identity is verified, eligibility is checked, a chart with history is prepared, and the dentist stabilizes and documents the visit for billing. If there is no ID, reception explains policy and offers acceptable alternatives. If alternatives are accepted, a conditional verification may allow limited stabilization and proper documentation. If not accepted, the patient is referred to an FQHC or public clinic, where intake, triage, and stabilization occur. Next, let us translate options into a quick reference table you can use when gathering documents. Use this table as a preparation checklist. Passports, including recently expired in some cases, and consular IDs may be usable depending on office policy. Non-driver state IDs are often accepted. Temporary ID receipts can help when paired with an insurance card or a bill. Two document combinations may be viable with supervisor approval. Medical linkages, like prescription bottles or patient portals, can support identity verification by connecting you to an existing medical record. Next, we will lay out a step-by-step plan to act today. Here are concrete steps. First, call ahead and ask what identification or two document combinations the office accepts. Second, assemble at least two items such as an insurance card plus any photo ID, passport, or consular ID. Third, print or save patient portal pages that display your name and date of birth to support record linkage. Fourth, if a private clinic cannot proceed, call the nearest FQHC or public clinic immediately. Fifth, ask what emergency coverage actually includes and estimate any out-of-pocket costs. Finally, document all calls and decisions for clarity and continuity of care. Now, let us check comprehension with a quick quiz. Quiz time. The question is, which is the primary reason a dentist cannot safely proceed without verifying identity? Option A, they prefer to delay care for business reasons. Option B, they cannot reliably access accurate medical history and verify coverage without ID. Option C, they want to avoid emergency cases entirely. Option D, they must collect extra paperwork for marketing purposes. You may pause the video now to think about the answer. We will discuss the answer in the next section of the video. The correct answer is, they cannot reliably access accurate medical history and verify coverage without ID. This is central to safe treatment and compliant billing. Without proper verification, both clinical safety and financial integrity are compromised. Next, let us try one more quick question on emergency coverage. Here is the second question. Emergency medical insurance usually covers which of the following during a dental crisis? Option A, full restorative reconstruction of multiple teeth. Option B, stabilization of life-threatening infection or severe systemic risk. Option C, any dental service requested by the patient. Option D, cosmetic enhancements. You may pause the video now to consider your answer. We will review the correct choice next. The correct answer is stabilization of life-threatening infection or severe systemic risk. Emergency medical benefits are generally intended to stabilize immediate danger rather than fund comprehensive restorative procedures. With the key concepts reinforced, let us move to the essential takeaways. These are the core takeaways. Identity verification is essential for safety, legal compliance, and financial solvency. When you lack ID, bring alternatives like passports, consular IDs, two document combinations, and medical linkages. FQHCs and public clinics can stabilize urgent cases and often have more flexible intake procedures. Emergency coverage is typically about stabilization, not full restoration. Lastly, preparation, calling ahead, and documenting interactions can make your path to care much smoother. We will conclude with a concise summary. In summary, identity verification enables safe treatment, valid billing, and regulatory compliance. If you lack standard ID, assemble alternatives and seek a supervisor review. When private clinics cannot proceed, FQHCs and public clinics are structured to stabilize urgent conditions. Remember that emergency coverage is aimed at stabilization, not full restoration. Use the step-by-step action plan to make calls, gather documents, and get stabilized care swiftly. As we wrap up, here is a final note. Thank you for watching. If this video clarified the ID question and gave you a plan, please like, share, and subscribe. Share your experiences and questions in the comments so others can learn from your insights. Your participation can help someone facing the same barrier today.